Good evening and welcome. I'm Sheila Balgobin and I am the Dream Decipherer, and I help you to crack the code of your sleep and dreams so you can sleep sound and dream deep. This evening's subject is looking at the relationship between depression and sleep. Whereas most people who have experienced depression know that it is often accompanied by sleep problems of some kind or other. People who are depressed find it difficult to fall asleep or to stay asleep during the night. And they may be excessively sleepy during the day or may even sleep too much. But at the same time, sleep problems can actually worsen depression, leading to this vicious cycle or vicious circle between depression and sleep that can be really difficult to break. And it may even be that poor sleep actually causes depression in some people. So it's really important to understand that where which is driving what. Is it the depression that's driving the sleep problems, or is it the sleep problems that have caused the depression? And it can be hard to untangle which it is. But first of all, people talk about being depressed, people throw the word around all the time, but what exactly is depression? Feeling sad, disappointed, or hopeless are natural and healthy reactions to challenges that we face in life. Normally, these feelings may come in pulses or waves and are tied to thoughts or reminders of different situations that were challenging. But these feelings will only last for a short period of time and will not interfere with school, work, or relationships, whether personal or professional. But when a person is depressed, these same feelings take a different path. And when these symptoms are persistent for more than 2 weeks or felt nearly every day and remain for most of the day, they're experiencing what falls into a group of mood disorders that are called depressive disorders. This is also referred to as clinical depression, which is an actual diagnosis, a medical diagnosis. And it will include feelings of sadness, disappointment, and hopelessness. But there are other emotional, mental, and even physical changes that occur that lead to difficulties with carrying out normal life. Here's a fact for you. Major depression is thought to be the second leading cause of disability worldwide, which is affecting some 4% of the world's population, and is a major contributor to the burden of suicide and ischemic heart disease. But what exactly causes depression? And unfortunately, researchers don't actually know what the exact cause is, but they recognize that there are clearly several factors that play into and increase the risk of developing depression. This includes particularly personal or family history of depression, experiencing major stressors or traumas, such as the death of a loved one, a beloved pet, losing a job or your home. Taking certain medications can also cause depression, and having specific illnesses as well. Family history factors into about half of people diagnosed with depression. And a person's genetics may actually affect the ability of neurotransmitters, which help the nerves cells to communicate with each other, that are actually linked to depression. So, for example, serotonin, dopamine, and norepinephrine. I can never get that one right. So, how do you know that you, or how can you perhaps suss out that you may actually be depressed? There can be physical changes as well as changes in moods and thoughts that interfere with normal daily activities. Symptoms may include, and remember, everyone is an individual, so that what this is just a sampling of some of the behaviors that may be exhibited by someone with depression. But it could be persistent, sad, low, or irritable moods, a loss of interest or pleasure in activities, and a loss or of libido, difficulty concentrating, just become woolly headed, no appetite or binge eating, feeling hopeless, worthless, or guilty. You have less energy and tire easily. You're either not sleeping at all or you're sleeping too much. And unfortunately, if at a worse state, you may even have thoughts of death and suicide. For whatever reason, depression is more common in women, and there may be differences in the symptoms of depression based on sex and age. Men often become irritable and angry, whereas women become sad and feel guilty. Adolescents may be irritable and have trouble in school, or just drop out. And younger children may pretend to be sick or worry that a parent may die. So there, as I said earlier, the how people react to depression or their behavioral changes due to depression can vary in a number of ways depending on circumstance and the temperament of the person. How then does this depression actually get diagnosed? It can only be diagnosed by a medical professional. So people who think they may be exhibiting or believe they are exhibiting symptoms of depression need to talk with their doctor or counselor, or some other health professional for guidance as to what to do next. One of the things that they'll ask is how long have the symptoms been going on and how severe they are and how it's impacting your daily life. Tests may also be suggested in order to better understand what's going on, as well as going forward to be able to monitor changes, improvements over time. You could even be referred to a sleep specialist, to be able to determine whether there's an underlying sleep disorder that's driving the depression, such as sleep apnea or restless leg syndrome, or which can either be causing the depression or contributing to the symptoms of depression. Now, earlier I mentioned this group of mood disorders that are called depressive disorders, but what exactly is that? When you have significant feelings of sadness or loss of interest in normal daily activities, this is usually indicative of these depressive disorders. Specific forms of depression are based on the severity of the symptoms and the situation in which they are occurring. The most well-known type is major depressive disorder and is marked by symptoms that affect a person virtually every day over an extended period of time and commonly involves sleep disruptions. A persistent depressed disorder, also called dysthymia or chronic depression, may involve fewer symptoms than major depression, but the symptoms have lasted for a longer period of time, at least 2 years and 1 year in children and adolescents. And if there's any symptom-free periods, they will usually not last longer than a couple of months. There's also depression that may come during the menstrual cycle, which is called premenstrual dysphoric disorder, and seasonal affective disorder or winter blues, But these tend to come and go over shorter periods for obvious reasons, but they can also create sleep problems. So, what is the relationship exactly between depression and sleep? They're so closely related that doctors will actually hesitate to diagnose depression when there is no complaint about sleep. That's how closely they're linked. Almost all people with depression experience some kind of sleep issue. Now, in the previous lives, I've looked at the impact of grief on sleep and depression, and where I stated rather that grief, depression, and sleep issues have a bi-directional relationship. It's a chicken and egg. Is it the depression driving the sleep problems, or the sleep problems driving the depression? So it makes, because of this relationship, it makes it much more difficult to be able to determine which happened first. But sleep issues associated with depression can include insomnia, hypersomnia, which is excessive daytime sleepiness, and sleep apnea, where there's an actual brief stoppages of breathing during sleep. Insomnia is the most common problem and is estimated to occur in 75% of the adult patients who are diagnosed with depression. It is also believed that about 20% of people with depression may have what's called obstructive sleep apnea, where the breathing stops for various reasons. And 15% have hypersomnia, or they're falling asleep during the day. Many people with depression may actually swing back and forth between insomnia and hypersomnia during a single bout of depression. Um, Sleep issues may also contribute to the development of depression through changes in the function of the neurotransmitter serotonin, which is produced during the deeper levels of sleep. These sleep disruptions can affect the body's stress system, disrupting our circadian or waking and sleeping rhythms and increasing our vulnerability for depression. But the good news is that most people who are treated for major depression often report improved sleep as well. How can depression be treated? What can be done? Um, it's best to get advice from a doctor or other or mental health provider to understand exactly where you are in your depression or depressive state, because it's just like everything else. Different things will work for different people. But certainly, some of this simple things that you can do, and I'll talk about, more the more professional side of things, but self care can do a lot, such as exercise. And when you're depressed, it's hard to get motivated to start. Even when you're not depressed, it can be hard to get started in a new routine. But developing a fun and relaxing exercise routine can actually be an important factor in reducing depressive feelings, simply because your body is flooded with endorphins, or feel good hormones. And in fact, studies have actually shown that regular exercise significantly decreases the symptoms of depression. So it's not only good to help you to sleep better because you tire your body out, but it's good for your mental health as well. Self-care is really important, but when you're in the throes of depression, self-care is the last thing on your mind, when it should be the first thing, actually. Even doing little things for yourself, a scented bath, taking a nice long walk on a nice day, having giving yourself an aromatherapy treatment, or just putting a few drops in a burner, um, getting a haircut, taking your dog for a walk, whatever it is, whatever that would make you feel better. And in fact, pets are a really good way to get us to come out of our shells a little, at least a little bit, because they don't judge us, they love us anyway, and we feed them, so they'll hang around. But I mean, again, joking aside, pets, they take them into nursing homes and they lower blood pressure by like 10 points or something. So they really do help increase the feel good factor. Now, on the more professional level of things, counseling is certainly something worth looking into. And there's even counseling that is geared specifically for insomnia. So it focuses on managing chronic insomnia. Therapeutic counseling and psychotherapy can also be quite helpful because they help to peel the onion, as I call it, and help people get to the heart of what is causing the emotional upset, and therefore mitigate or even eliminate what's driving the sleep problems and depression, or vice versa, whichever came first. Medication, of course, antidepressants have their place, but they take time to work, and you may need to go through several rounds of different antidepressants before finding one that actually works. A doctor or a psychiatrist must prescribe them, and will have to discuss with their patient the appropriateness of these medications, and recommends have specific recommendations for them. However, care must be taken with these medications, because if you're on them for too long, what starts to happen is that you start to not feel anything at all, anytime. You become emotionally dead, and it's hard to get off again. So it's something that, in the short term, they can be helpful, but it's worthwhile considering a plan B, so that you're not on them for too long. There are even more invasive procedures or therapies when medications and other treatments are just not effective. Some people require therapies, rather, such as electroconvulsive therapies. I think they used to call it electroshock years ago, but it's a brief electrical stimulation of the brain with the patient under anesthesia. So it's a quite serious procedure, and it's usually administered by a team of medical professionals. There's also something called repetitive transcranial magnetic stimulation, and this is where an electric coil is placed against the scalp near the patient's forehead. And this electromagnetic painlessly, it says, delivers a magnetic pulse that stimulates the nerve cells in the part of the brain that's involved in mood control and depression. It sounds, perhaps, as a layman, like a slightly less invasive version of the electroconvulsive therapy. And finally, there's something called vagus nerve stimulation, which in which regular mild pulses of electrical energy are sent to the brain via the vagus nerve, which is a major nerve in the body, through a device that is similar to a pacemaker. These treatments can be effective, but have to be, again, under the care and guidance of medical professionals. And as with medication, some people may experience side effects with certain treatments. But treatment isn't kind of silver bullet can't use a silver bullet approach. And in fact, what they have found over time is that combining approaches actually shows better rates of success. And I know as a therapist myself that I have found that working with my clients in a somewhat eclectic manner, from using everything from house plants to uh, visualizations, that treating the treating the person is what's essential, rather than treating their symptoms and just sending them off with a prescription. So what I can give you some tips if about sleeping better. What are they? um well, sleep problems can increase the risk of initially developing depression. Persistent sleep issues also create the risk of relapse in people who have successfully been treated for depression. So, taking steps to sleep better and boost your mood can help decrease some of the problematic symptoms of depression, such as keeping a regular sleep and wake time. Having a regular schedule um, is helpful because it trains the brain and the body that to start ratcheting things down in preparation for sleep. And it also it well, I mean, developing some kind of routine will also help that process, whether it be a few drops of aromatherapy oil in the burner for half an hour to 45 minutes before going to bed. It may be reading some, or doing a quiet meditation, not exercise, because exercise stimulates the body, but to again to train the brain to, like, oh, it's getting time to go to sleep, so start to quiet down, and to help you to be able to fall asleep better. Naps are a great thing. Those power naps are great, but they should not last more than 10 to 20 minutes. Anything longer than that, and you're already having sleep problems, is increasing the likelihood that you will have poor sleep at night. So it's anything then shorter than 10 minutes isn't beneficial enough. Anything longer than 20 minutes is going to interfere with your sleep at night. So, split the difference. A 15-minute power nap can, in the short term, is actually good for you. It increases your short-term memory, your, what am I trying to say? I can't talk today, but it can also, in terms of productivity, it will help you to think and work, act more efficiently. In the short term, power naps, they're a great thing, but to be used judiciously. Alcohol. Alcohol is a big thing. While it may be really tempting to have a drink or two to relax and to get sleepy, alcohol actually has a negative impact on our sleep. Studies have shown that binge drinking before bed actually leads to difficulty falling asleep and staying asleep. And even moderate drinking is enough to disrupt your sleep cycle and shorten REM sleep. And the reason for that is because instead of going through the normal stages of sleep and going to the deepest level where the body and brain are repairing and resting, um, you go straight from drunk to almost the deepest level of sleep, bypassing those normal stages. And therefore, the normal processes that should take place, including producing hormones that will help you to sleep and have a better mood, don't have the time to take place. So, having a drink is nice, but if you're trying to sleep, you do better to have some warm milk or chamomile tea. And finally, get outside. This, which comes back to the people with pets, particularly dogs. Um, They have to get outside unless they're going to have their dog make a mess in the house. One of the simplest ways to aid your sleep if you're suffering from depression is to spend time outside. They used to, in the back in the day, when in during the days of free love and hippies, people used to laugh and about tree huggers, but actually hugging trees is really a very, or at least resting against a tree is actually a very healing thing to do, both for the tree and for the person. um, and exposure to daylight, not necessarily sunlight, but daylight, helps us to our internal clock to align with our circadian rhythms, our sleep wake patterns with the day. Once the sun sets at a certain level, the body starts to producing, or starts to start producing the hormones that will lead eventually to sleep. So the best way to trigger that naturally is to spend time outdoors. So there you have it. Some facts and figures, and hopefully some useful tips with regard to depression. But one thing I would say, if you're experiencing any of these symptoms at all, get in contact with your health professional immediately, particularly if you're having darker thoughts and even thoughts about suicide. Call it in a national suicide hotline in the US, or call the Samaritans, or someone, or other groups and charities that deal with suicide prevention, as immediately. Do not hesitate. If you need information about that, you can certainly send me a personal message, and I will certainly give you some information to help you with that. Thanks so much for watching and listening. Have a great evening and start to the week, and I'll see you again soon. Take care. Bye bye.